Hi, I'm Dan Sosnowski, the editor of Chiropractic Economics, and we're here at the Parker Las Vegas 2018 convention. And I'm here with Travis Fry. He's the vice president of PureWave, part of Pato Corporation. And we asked him to join us here to just give us some of his thoughts on the kind of area of medicine that he's working with. So Travis, I just want to first off welcome.
Yep.
And I just want to ask you, the patients who go to chiropractors want to heal quickly, they want to heal effectively.
Yeah.
What are some things that DCs can do to help them in that effort?
You know, I'm not a chiropractor, but I've worked with a lot of chiropractors. We sell our products to a lot of chiropractors. We get tons of feedback. And, I'm just like a perpetual student. And I learned so much from every single one of them. We deal with a lot of podiatrists, chiropractors, the whole gamut of therapists. And from what I hear, to speed up the healing process, there's no quick fix, and that's pretty much it for life. It's just you got to put in the work.
Yeah.
And what I hear is effective is having multiple modalities of treating the pain, treating the issue. When you have inflammation, they use ice therapy, heat therapy. The heat to increase the circulation, stretching, massage. There's all kinds of cutting-edge technology as well, like platelet injections, stem cell injections.
Oh, yeah.
I don't know much about that, but I know there's probably endless possibilities of innovating in this field of understanding the human body.
Yeah.
And the great thing about chiropractors is they really understand the human musculoskeletal system.
Yeah.
And we're just a sponge to understand more about the body as a company and as innovators.
Right.
And we're all about knowledge for our customer base, and chiropractors are our customer, but we're also their students, and it's this constant learning. But I think those key things, ice, heat, massage, stretching, and other innovative technologies is really where it's at as far as healing fast and hitting the pain with multiple modalities.
Yeah. Well, one of the things that chiropractors are very familiar with is instrument-assisted soft tissue mobilization, IASTM.
Yeah.
And your device, the pulse wave. Right?
Yeah, PureWave.
The PureWave. It's a kind of a percussive therapy device.
Exactly.
And it's going to hit a lot of those points. It's going to hit your myofascial release. It's going to promote lymphatic drainage. You're going to get a lot of the mechanoreceptor activation. And so doctors who are looking at adding that kind of percussive therapy to their practice, what kind of advantages does that offer them?
Well, I think it's a huge advantage, and especially with a product like ours, it's much more accessible, it's more affordable. They don't have to spend thousands of dollars to bring this into their practice.
Yeah.
And it gives them just one more method one more method to treat the pain for their patients. And also, when you're doing this for years and years, you're putting a lot of stress on your body. If you're doing manual therapy with your hands, there's a lot of stress. For 25 years, I'm sure you're going to have thumb problems or osteoarthritis or some wrist problems. And a device like ours really helps them to build it into their patient care, their workflow. It just adds another tool set for them to apply and to use and to get that patient feedback loop. And
like you say, it can be a practice extender or avoid repetitive motion injuries and overuse injuries. And for the practitioner as well.
And as you mentioned, the percussion itself, what that does is it really gets deep into the soft tissue and increases blood flow. It's great for pain control, getting those trigger points released, working the myofascia.
I was just trying it out over at the booth myself, and that thing really felt great. I've tried a number of these devices, and I'll tell you, that one was
people see our ads are like, well, I'm not sure if it's a scam or if it really works. But the feedback we get from consumers, from the doctors, it's just
the real deal.
It's amazing, and we're continually trying to improve the product.
Yeah. Well, hey, one thing, I see chiropractors and LMTs, massage and chiro, kind of working collaboratively, in the future. A lot of DCs pretty much just have an LMT on staff as a matter of course. How do you see that relationship developing over the next few years? Do you have any insights on that?
Yeah, I think it's, the manual therapy, the massage, I think it's a critical part to working the human musculoskeletal system. I mean, we're all about, human touch.
Yeah.
And understanding those pain, like when you're working the body, I'm sure you can really get great feedback from your fingers just to understand like where those stiff points are. And then we're about, just giving another tool to just give them that extra, power to work with patients.
Okay.
Yeah.
Well, anybody here has a chance to swing by your booth and check it out, I invite you to do so. It's
booth 901.
All right, Mr. Fry, thank you.
Dan, thank you so much.
With us.
All right, thank you.